Ever cleared your throat over and over again throughout the day, only to feel like the mucus comes right back? Maybe it's worse in the morning. Maybe you constantly feel like something is stuck in your throat, even after drinking water. You cough, swallow, clear your throat again, and yet the sensation never completely goes away. If this sounds familiar, you're far from alone. Many adults, especially those over the age of 60, quietly live with this frustrating problem every single day. Some assume it's just part of getting older. Others believe they simply have allergies or that they caught a lingering cold. But here's what surprises many people. Constant mucus in your throat is often your body's way of trying to tell you something important. Sometimes the cause is relatively harmless and easy to manage. Other times, persistent mucus can be an early warning sign that something deeper is affecting your digestive system, your sinuses, your lungs, or even your lifestyle habits. The good news? Once you understand what's really causing it, many people are able to significantly reduce the problem and breathe, speak, and swallow more comfortably. Today, we're going to uncover the real reasons why mucus keeps collecting in your throat. We'll explain what mucus actually does, why your body produces it, the hidden medical conditions that can increase it, the everyday habits that may be making it worse, and the simple lifestyle changes that often help. By the end of this episode, you'll have a much clearer understanding of what your body may be trying to tell you, and you'll know when it's time to seek medical advice. So, if you're ready to discover the real causes behind constant throat mucus, let's begin. Your throat over and over again, wondering why that annoying sensation never seems to go away. Maybe you wake up every morning with a thick feeling in your throat. You take a sip of water, cough a few times, and clear your throat, hoping it will disappear. For a few moments it feels better, but before long, the feeling comes right back. Perhaps you're speaking with friends or family when you suddenly have to stop mid-sentence to clear your throat. Maybe you feel embarrassed during a meeting, at church, or while talking on the phone because you constantly need to cough or swallow. Or perhaps every night before bed, you notice that uncomfortable feeling of mucus collecting in the back of your throat, making it difficult to relax or even fall asleep. If any of this sounds familiar, you're certainly not alone. In fact, millions of people experience persistent throat mucus every single day. It's one of the most common complaints seen in primary care clinics and ear, nose, and throat specialists. Adults over the age of 60 report this problem more frequently than younger people, but it can affect individuals of all ages. For some people, the mucus is thin and watery. For others, it feels thick, sticky, and almost impossible to clear. Some describe it as a lump in the throat. Others say it feels like something is constantly stuck there, no matter how much they cough or swallow. Because these symptoms often develop gradually, many people simply learn to live with them. They assume it's just another unavoidable part of getting older. Some blame the weather. Others think they have allergies. Some believe they caught a cold that never completely went away. And many people simply ignore the problem altogether. But here's something important that many people don't realize. Your body almost never produces symptoms without a reason. It's really something your body does randomly. More often than not, it is responding to irritation, inflammation, infection, dryness, digestive problems, environmental triggers, or other underlying conditions. In other words, your body is trying to protect itself. And understanding why it's doing that is the first step toward finding relief. Today, we're going to explore the real reasons behind constant throat mucus using clear, easy to understand explanations based on what doctors know about how the respiratory and digestive systems work. By the end of this episode, you'll understand why mucus forms, why some people produce much more of it than others, what common conditions may be causing it, and what practical lifestyle changes can often help reduce it. We'll also discuss the warning signs that should never be ignored and explain when it's time to seek medical advice. Now, before we continue, there's one very important thing we want to make clear. The information in this video is intended for educational purposes. It is designed to help you better understand your health and the possible reasons behind persistent throat mucus. However, it is not a substitute for professional medical diagnosis or treatment. If your symptoms are severe, continue for several weeks, worsen over time, or are accompanied by concerning symptoms such as difficulty swallowing, coughing up blood, unexplained weight loss, chest pain, or persistent hoarseness, it's important to consult a qualified healthcare professional promptly. The more treatment options are often available. Now, let's begin with one of the biggest misconceptions people have about mucus. Many people believe that mucus is dirty. They think it's something harmful that shouldn't be there. But surprisingly, nothing could be further from the truth. Mucus is actually one of your body's most important natural defense systems. Every single day, even when you're perfectly healthy, your nose, throat, lungs, and digestive tract continuously produce mucus. In fact, your body makes a significant amount of mucus every day, even though you rarely notice it. Most of the time, this process happens quietly in the background. You breathe, the mucus traps dust, it catches bacteria, it captures viruses, it filters pollution, it collects tiny allergens floating in the air. Then microscopic hair-like structures inside your airways gently move that mucus toward your throat, where you unconsciously swallow it. You don't feel it, you don't notice it, and that's exactly how it's supposed to work. Problems begin when this delicate system becomes disrupted. Sometimes your body starts producing far more mucus than normal. Other times, the mucus becomes much thicker than it should be. Sometimes the tiny cleaning system inside your airways slows down, making it harder to move mucus out efficiently. Instead of flowing naturally, the mucus begins collecting in places where you can actually feel it. That's when you start clearing your throat repeatedly. That's when swallowing becomes uncomfortable. That's when your voice may sound hoarse. That's when coughing becomes more frequent. And that's when many people begin searching for answers. One reason this problem becomes more common as we age is that our bodies naturally change over time. Tissues lining the nose and throat may become drier. The tiny cilia responsible for moving mucus don't work quite as efficiently. Muscles involved in swallowing may lose some strength. Certain medications can reduce moisture in the mouth and airways. Our immune systems also respond differently to irritation than they did when we were younger. Even common health conditions such as acid reflux, chronic sinus inflammation, diabetes, or lung disease become more common with age. Each of these factors can contribute to persistent throat mucus. Sometimes, more than one cause is present at the same time. For example, a person may have mild allergies along with silent acid reflux, or they may be slightly dehydrated while taking medications that dry out the mouth. The combination can make symptoms much more noticeable than either condition alone. That's why treating the problem isn't always as simple as taking a cough syrup or throat lozenge. The real solution depends on identifying what's triggering the excess mucus in the first place. Throughout this episode, we'll carefully examine some of the most common causes, as well as a few surprising ones that many people never consider. Some of these causes are relatively harmless and can often be improved with simple lifestyle changes. Others require medical evaluation and specific treatment. The key is learning how to recognize the difference. As we move through today's discussion, you may notice that several of the symptoms we describe sound very familiar. Perhaps you've experienced frequent throat clearing for years. Maybe your symptoms only occur after meals. Perhaps they're worse during allergy season. Or maybe they become much more noticeable first thing in the morning. These small details often provide important clues about what's actually happening inside the body. Doctors ask so many questions when evaluating chronic throat mucus. When did it begin? Does it happen every day? Is it worse after eating? Does lying down make it worse? Do certain foods trigger it? Are there seasonal changes? Do you also have heartburn, nasal congestion, coughing, or shortness of breath? Each answer helps narrow down the possible causes. And today, we're going to walk through those possibilities together. Our goal isn't to overwhelm you with complicated medical language. Instead, we want to help you understand your body in a way that's practical, reassuring, and useful. Knowledge empowers better decisions. When you understand why symptoms occur, you're far more likely to recognize patterns, avoid common mistakes, and know when professional care may be needed. You may even discover that a simple change in your daily habits makes a significant difference. Perhaps increasing hydration, managing allergies more effectively, changing the timing of evening meals, improving indoor air quality, or addressing a health condition that has gone unnoticed for years. Sometimes, relatively small adjustments can lead to surprisingly meaningful improvements in comfort and quality of life. So, if you've been frustrated by that constant need to clear your throat, if you've wondered why the mucus never seems to disappear, or if you're simply curious about what your body may be trying to tell you, you've come to the right place. Over the next several sections, we'll uncover the hidden causes behind persistent throat mucus, explain why they're so common, especially in older adults, and discuss evidence-informed strategies that may help reduce symptoms and improve your daily comfort. Some of what you're about to learn may surprise you. In fact, one of the most common causes of persistent throat mucus has nothing to do with your throat at all. We've talked about why persistent throat mucus deserves attention. Let's begin by understanding something that surprises many people. Mucus is not your enemy. In fact, it's one of the most remarkable and essential defense systems your body has. Without it, every breath you take would expose your lungs and airways to dust, germs, pollution, and countless microscopic particles with very little protection. Most of us don't think about mucus until it becomes excessive. We notice it during a cold, allergy season, or when we constantly feel the need to clear our throat. But even when you're feeling perfectly healthy, your body is producing mucus every hour, every day. That's because mucus plays an incredibly important role in keeping you alive and well. Imagine walking through a busy city street on a windy day. The air may look clean, but every breath contains tiny particles of dust, pollen, bacteria, viruses, smoke, mold, spores, and pollutants. If those particles reach your lungs without any protection, they could cause irritation, infection, or damage. Fortunately, your body has a built-in filtration system. The inside of your nose, throat, sinuses, windpipe, and lungs is lined with a thin layer of mucus. This slippery coating acts like sticky flypaper. As you breathe, harmful particles become trapped before they can travel deeper into your respiratory system. But trapping these particles is only half the job. Your body also has to remove them. That's where another amazing defense mechanism comes into play. Lining your airways are millions of microscopic hair-like structures called cilia. These tiny structures are constantly moving in a coordinated wave-like motion. Although they're far too small to see without a microscope, they work tirelessly every second of every day. Think of them as tiny conveyor belts, the back of your throat. Once it reaches your throat, you unconsciously swallow it, and your stomach acid safely destroys many of the germs trapped inside. Most people never notice this process because it's happening all the time without causing any discomfort. In fact, experts estimate that healthy adults swallow mucus hundreds of times every day without realizing it. That's how efficient the system normally is. So if mucus is supposed to be there, why does it suddenly become such a noticeable problem? The answer usually comes down to one of three things. First, your body may start producing too much mucus. Second, the mucus may become thicker and stickier than normal. Third, the cilia may not be moving the mucus efficiently, allowing it to collect in your throat instead of clearing naturally. Let's look at each of these more closely. When your body produces too much mucus, your body increases mucus production whenever it senses irritation or potential danger. For example, if you develop a viral cold, your immune system responds by producing extra mucus to help trap and remove viruses. If you're exposed to pollen during allergy season, your body may create more mucus in an attempt to wash allergens away. If cigarette smoke irritates your airways, mucus production often increases as a protective response. Even dry air, strong perfumes, cleaning chemicals, air pollution, and certain workplace exposures can stimulate the mucus glands to work harder. From your body's perspective, this is actually a smart survival strategy. The extra mucus forms a protective barrier over sensitive tissues and helps flush away substances that could otherwise cause damage. The problem arises when the irritation doesn't go away. Instead of producing extra mucus for a few days, your body may continue producing it for weeks, months, or even years. That's when chronic throat mucus develops. This becomes too thick. Quantity isn't the only issue. Sometimes your body isn't making much more mucus than usual, but the mucus itself changes. Healthy mucus is normally thin, slippery, and easy to move. It flows smoothly through the airways without causing any noticeable sensation. But several factors can make it thicker. Not drinking enough water is one of the most common reasons. When you're dehydrated, your body conserves water wherever it can. As a result, mucus loses moisture and becomes concentrated. Think about the difference between fresh honey and honey that's been sitting in the refrigerator. One flows easily, the other moves much more slowly. Mucus behaves in a similar way. The thicker it becomes, the more likely it is to cling to the back of your throat instead of moving naturally. This is why many people notice temporary relief after drinking warm fluids or increasing their water intake. Proper hydration doesn't necessarily stop mucus production, but it often helps keep mucus thinner and easier to clear. When the cleaning system slows down, even if mucus production remains normal, problems can still occur if the cilia aren't working efficiently. These tiny hair-like structures are extremely sensitive. Smoking is one of the biggest enemies of healthy cilia. The chemicals in cigarette smoke damage these delicate structures, making it much harder for mucus to move. Long-term exposure can significantly slow the cleaning process, allowing mucus to build up inside the airways. Air pollution may have a similar effect. Certain viral infections can temporarily damage cilia as well. And as we age, cilia naturally become somewhat less efficient. This means that even normal amounts of mucus may begin to linger longer than they once did. Many older adults notice they need to clear their throat more frequently, especially first thing in the morning. Part of this is simply because the natural cleaning system has slowed over time. Growing older doesn't automatically mean you'll have constant throat mucus. However, Aging does create several changes that make the problem more likely. For example, the tissues inside the nose and throat gradually become drier. Many older adults take medications that reduce saliva production or dry the airways. Blood pressure medications, certain antidepressants, antihistamines, and other commonly prescribed drugs may contribute to dryness in some individuals. When moisture decreases, mucus naturally becomes thicker. The muscles involved in swallowing may also become slightly weaker with age. Although these changes are often subtle, they can make mucus feel more noticeable. In addition, many health conditions become more common later in life. Acid reflux, chronic sinus inflammation, seasonal allergies, chronic lung disease, diabetes, sleep apnea. Each of these conditions may increase mucus production or affect how efficiently it's cleared. It's often not just one factor. Several small changes may combine to produce one persistent symptom. Mucus color. What does it mean? Many people assume that the color of mucus always tells them whether they have an infection. But that's not entirely true. Clear mucus is usually considered normal. It often appears with allergies or mild irritation. White mucus may simply indicate thicker secretions due to dehydration or congestion. Yellow or green mucus can occur during infections because immune cells accumulate within the mucus. However, it doesn't automatically mean antibiotics are needed. Sometimes viral infections produce yellow or green mucus without any bacterial infection. Brown or black mucus may occur after exposure to heavy pollution, smoke, or certain environmental particles. Blood-streaked mucus can sometimes result from irritated nasal tissues, especially after frequent nose blowing. The whole story. Doctors also consider symptoms such as fever, facial pain, cough, breathing difficulty, duration of illness, and medical history before determining the underlying cause. Why constant throat clearing can make things worse. Here's something many people don't realize. Although clearing your throat provides temporary relief, doing it repeatedly throughout the day can actually create a frustrating cycle. Each time you forcefully clear your throat, the delicate tissues become irritated. That irritation may stimulate even more mucus production. Soon, the throat feels irritated again. You clear it again. More irritation develops. More mucus follows. Over time, this cycle can become almost automatic. Some people clear their throat dozens or even hundreds of times a day without realizing it. Doctors often encourage patients to sip water, swallow gently, or identify the underlying cause instead of relying solely on constant throat clearing. Breaking this habit may reduce irritation over time. Your body is trying to protect you. Perhaps the most important lesson to remember is this: your body doesn't produce mucus to annoy you. It produces mucus to protect you. Whether the trigger is allergies, acid reflux, infection, pollution, dehydration, or another condition, excess mucus is often your body's attempt to defend delicate tissues from further irritation. Instead of asking, "How do I get rid of this mucus?" a better question is, "What is my body trying to protect me from?" Once that question is answered, treatment becomes much more effective. Rather than simply masking the symptom, you can begin addressing the actual cause. And that's exactly what we'll do next. Now that you understand how mucus normally works and why it's such an important part of your body's defense system, it's time to explore the hidden conditions that can cause mucus to build up in your throat day after day.